All right, we're still in module 11 for chapter 35. So, speech and language disorders. We're done talking about the disorder for vision and hearing, which is also common, visible. It is also visible and common in the facility. We also have speech and language disorders, right? This means it involves difficulty speaking, understanding, reading, or writing. It can occur at any age, but most commonly for like an elderly clients, especially if clients who has existing illnesses like dementia, Alzheimer's, Parkinson's disease, etc. Right? Again, not the same as language differences in non-native English speakers. So that's not a disorder. Okay, if they cannot speak English because they have different language, that means it's just that they don't understand English. It's not because they have language disorders. So the causes of speech and language disorders, it could be a genetic problem. Maybe when they were born, they already have that issue in terms of the speech and language disorders. It could have because of acquired brain injury. Example would be stroke. It could be a brain infection or any substance use. And of course, we also have because of any certain disease or hearing loss, right? Brain tumors or speech mechanism problems. So those are some of the causes that might ha- that might lead to disorders. So first, we have what we call aphasia. So when we talk about aphasia, it's a partial or total loss of speech and language due to brain injury. Common causes include stroke, head injury, and brain tumors. It's also often associated with significant emotional needs because they might kind of get so emotional because they cannot express what they want to express. And types of aphasia, we have receptive aphasia, which means difficulty understanding spoken or written language. That's receptive. Expressive aphasia, it's difficulty speaking or writing. And then receptive aphasia is difficulty with both expression and comprehension. Okay, again, we have receptive, expressive, and both expressive, receptive. Next, apraxia of speech. Client knows what they want to say, but they cannot coordinate speech muscles. So they, in their mind, they want to say something, but they cannot say it because their speech muscle is not coordinating. It could be caused by damage to the motor speech area of the brain. So for apraxia, their speech is slow and inconsistent, right? Dysarthria, it's a difficulty speaking clearly due to muscle weakness and paralysis. So there might be some paralysis happen. Same thing with common causes. It could be because of stroke, cerebral palsy, or neurological diseases that the client encountered. Speech errors are usually consistent and predictable because it's like usually it's same thing that's happening, right? So the speech errors, it's usually consistent and predictable. So what are the emotional effects of speech disorders or language disorders? Sometimes the client avoid social situations and relationships because of the disorder that they have, because they cannot express what they really feels. Sometimes they feel stressed, frustrated, and depressed because of the situation. And of course, of employment and difficulty with their daily tasks because of the barrier to communicate. So, what are the treatment and approaches? So, speech language therapy that is intended for the client's condition, individualized care, and make sure to encourage them using the remaining communication abilities. If they can still communicate in a different form or way, encourage them to do that. And of course, some learning alternative technology and all that stuff, right? So, those are some of the learning alternatives. We can also provide communication aids like picture or word communication boards, We can also use, as what I've told you, through technology, there's some electronic and mechanical devices to generate the speech of the individual so that they can communicate and they can deliver what they want to deliver through the technology. And of course, a computer assisted communication systems, right? There might be a lot, depends on the client's condition and depends on what the doctor will prescribe or order as well. So when we are supporting them, just to continue, make sure you follow what's ever in the care plan and make sure we use appropriate communication skills because we don't want them to be misunderstood. Be mindful of the facial expressions and body language of your clients. And then we need to really very observant of that, right? And of course, please watch the signs of any fatigue or frustration because we need to comfort them. Again, as what I've mentioned in earlier, it could be frustrating and depressive to have issues with communication skills, right? So it's always good that you need to be watchful in terms of frustration and fatigue. So again, same thing. If you want to read further about chapter 35, you can always go to Foundations of Nursing, chapter 35, the speech and language disorders. Okay, so that's it for 35. I'll see you with the next chapter.